Good morning, everybody. Thank you again for being here. We're so excited and so pleased to have some phenomenal women with us, uh, kicking off our round of Child Abuse Prevention Month speaker series. And again, we are so pleased to have Sheila Boxley, who's the president and CEO of Child Abuse Prevention Center, and Katie Albright, who's the president and CEO of Safe and Sound, speaking on prevention opportunities and challenges. I'd like to give a little bio on each of our two honorable speakers today. Sheila Boxley has over 2 decades as president and CEO of the Child Abuse Prevention Center, dedicated to the prevention of child abuse and neglect. The CAP Center has grown from one local agency with 3 employees in 1997 to a statewide agency with 50 employees, 350 plus AmeriCorps and VISTA members, a 25-member board, and over 500 partner agencies. The center operates under 4 core strategies of advocacy, education, health, and safety, which collectively have generated impressive impacts on children, families, and communities. Sheila collaborates with multidisciplinary partners and sits on numerous local and statewide committees focused on child abuse prevention and national and community service. She serves as an appointed member of the California Child Welfare Council, Voices for National Service Steering Committee, Essentials for Childhood Leadership Team, California AmeriCorps Alliance, and Funding the Next Generation Advisory Committee, and others. Also with us today, we have Katie Albright, again, CEO and president of Safe and Sound. Katie is an attorney and children advocate with more than 25 years of legal and nonprofit experience. She started her career teaching and co-creating a preschool in Nairobi, Kenya, where she learned the importance of community joining together to improve the lives of children. Katie has served as the Chief Executive Officer and President of Safe and Sound for the past 15 years. Joining at the time, it was called the San Francisco Child Abuse Prevention Center. Expanding its reach and impact under her leadership, the organization co-founded the Center for Youth Wellness, Children's Advocacy Center of San Francisco, and Partners in Prevention, and has created strong partnerships throughout California. Katie serves as the policy co-chair of the California Family Resource Association and is a member of the California Alliance, Child Welfare Council's Prevention and Early Intervention Committee, and the Prevention of Child Abuse and Neglect Citizens Review Panel. She actively presents as an expert throughout the state and country on matters of prevention, adverse childhood experiences, and community engagement. Katie's prior experiences include serving as the San Francisco Deputy City Attorney representing our public schools, San Francisco Education Fund Policy Director leading a campaign to improve teacher quality and increase student retention, and Preschool California Co-Director of Policy and Outreach, campaigning statewide for universal preschool. She has served on the boards of the NARAL, Pro-Choice America, NARAL, Pro-Choice California, Planned Parenthood Golden State, San Francisco Board of Appeals, and San Francisco Juvenile Probation Commission, as well as the San Francisco Day School. Again, please help me in welcoming both Sheila and Katie to really kick off this series with us. Thank you, ladies.
Thank you so much. It's such a pleasure to be here. Thrilled to be able to partner with you in our collective effort to strengthen families and prevent child abuse. Dorial and Sylvia, thank you for that warm introduction. I know Sylvia and I are thrilled to be here today. So I'm going to kick us off today and then turn it over to my amazing colleague, Sheila Boxley, to talk more about the activities around prevention. We are also gratefully joined by Kelly Barton, who is going to be running the tech for us. So thank you so much, Kelly. Again, I'm Katie Albright. I am working at Safe and Sound. We are a community-based organization in San Francisco, dedicated and focused to strengthening families and ending child abuse, like you. And so what we wanted to do today, if you go to the next slide, is to really talk about why prevention, and that will be short because we're all in this, and we know how important it is to have prevention efforts really focusing on strengthening families. Provide a little background and history, some data that you may not be aware of, and then turn to current policy issues at that point. And again, what I think is really important is that all of us have come from this community background in terms of our work, because we know that community is so critical to providing strength and support for children. And so I wanted to actually, in that, start with the first case of child abuse in our recognized case of child abuse in our country. And that is this little girl, Mary Ellen Wilson, because the child welfare system in which we all work at some level, whether or not we're on the prevention side or the intervention side, was created because of this single court case that happened to Mary Ellen Wilson over 150 years ago. It was on April 9th. It's one of the reasons why April is Child Abuse Prevention Month. April 9th, 1874, Mary Ellen Wilson testified in a New York court that her adopted mom had abused and neglected her severely. Mary Ellen was forced to sleep on a floor by a broken window. She had no warm clothes or shoes during those cold winter New York months. She was locked in a dark room, and she was forbidden to go outside. She was beaten and whipped almost daily until a neighbor, and actually a home visiting nurse, reported what was going on, and they did what any well-meaning person in 1874 would have done, because there was no child protection system at that time. So instead, they notified the American Society for the Prevention of the Cruelty to Animals, the ASPCA, because at that time, again, there were no government entities, there were no systems, there were no laws to protect children. Thankfully, the ASPCA brought Mary Ellen's case to court, and the judge in that case removed her from the home, from her adoptive home, based on the general laws of humanity. Now, you may know this case. Indeed, you may recall that it was indeed the first reported case of child abuse in our country. And over the past 150 years, our country has built a child protection system that we know about today, with mandated reporters that we all are, crisis hotlines, trained first responders, and a foster care system that protects children after they've been hurt. Now, while you may know about this case, my guess is you may not know about her biological parents, who I really want us to focus on a little bit. Frances and Thomas Wilson. They lived in a place in New York City called Hell's Kitchen. And by all accounts that I've read, they were loving and well-meaning parents. But life circumstances got in the way and prevented them to care for their children, for their daughter in particular. Thomas was a soldier in the Civil War. And when he died fighting for our country, Frances, who was then now a widower, took a job doing laundry. And she was working in a hotel, and she could no longer, doing laundry in a hotel, and she could no longer care for her infant daughter, Mary Ellen. So Frances boarded Mary Ellen, which was a very common practice at that time, so that her child would be safe. But when Frances' financial situation got worse, and we can think about the families that we're supporting right now, and particularly during COVID, Frances's financial situation got worse, and she missed visitation dates. She wasn't able to pay the boarding house, and so it was the boarding house that put Mary Ellen up for adoption, and then it was that adoptive family that led to the abuse in the court case that we all know about. So I bring this story up. I think I'm a history person, but I bring this story up because I think it's really important in telling what this history shares with us about prevention. Because my hope is that we would think about like how much better Mary Ellen's childhood outcomes might have been if we as a community, if we as a country had focused on supporting Thomas and Frances from the start. What if we had thought about supporting the parents from the start in the first place before they so desperately needed help? What if the community had networks of supports like family resource centers where Frances could have reached out for help when Thomas went off to war, access for food and housing and childcare? What if there were counseling services that were there available to help Frances cope with her tragedy, the loss of her husband, and the crisis that she was facing, taking care of her infant daughter alone? you have to imagine that if we had these kind of supports that were there creating this kind of community, how much better off they may have been. And so we think about going forward and the work that we're doing and thinking about 150 years later, the fact that we do have community supports now who are there to help families take care of their children, providing adequate food or access to food and housing and childcare and anything else that families need to provide support, and really going that upstream work and helping families. So thank you for letting me share that story with you, because I think it's really telling about where we are. And so Kelly, if you could go to the next slide. One of the things that we think about at Safe and Sound, but it's part of our whole child abuse prevention way of thinking, is that we want, as we wanted for Mary Ellen 150 years ago, we wanted to ensure that all children are happy and safe and thrive. But in order to do that, we really need to think about family surrounding them. And strengthening families and building the 5 protective factors, thinking about resiliency and age appropriate activity and parent understanding of childhood development and social connections and concrete supports. But in order to have that, you need a community that takes action to protect children. And surrounding that community is our county systems, government systems, city systems that are efficient and effective to help all children. The story about Mary Ellen was a story about a white little girl, and there are and were in 1874, there were many children of color who were living in very desperate neglect or abusive situations, maybe not by the hand of their own parent, who we as a country needed to protect. And so the other is, finally, we need a healthy society, a society that does not tolerate child abuse and that is anti-racist in our work. And so that's how we at Safe and Sound, but really the whole prevention movement is thinking about, is how do we have these layers of support so that we're not just thinking about the individual child, the individual family, but we have an entire community providing these networks of care for families. And if you go to the next slide, Kelly. And one of the reasons why this is so important is because the numbers of children who are impacted by abuse and neglect is dramatic. In 2020, when the last time we had our data, there were approximately 400,000 children who were victims of abuse and neglect, reported in our state, just reported as victims of abuse and neglect. That's about 1 child every minute in our state. And if you go to the next slide, you'll see that there was about 60,000 children that then became substantiated in terms of that our child welfare systems, our child welfare partners found that there was a substantiated victim of child abuse and neglect, in addition to 74 children who died because of abuse and neglect. So those numbers are sort of hard to sort of comprehend. So if you go to the next slide, you can see this is sort of a pictorial representation of what that of what those numbers look like. It's about 4% of the state's children were suspected, that darker blue, suspected victims of child maltreatment. 15% were suspected. 15% of those victims were then confirmed as maltreated, and a little less than 0.12% died as a result of maltreatment. And so you can see sort of the magnitude of all the numbers. When we're talking about these cases of maltreatment, we're using the legal definitions. So it's abuse, physical abuse, emotional abuse, sexual abuse, and neglect. But one thing that we know significantly, and this is in California, and it's frankly around the entire country and in each one of our jurisdictions, these numbers are sort of roughly about the same, that in California, it was about 49% of all of these cases, all of these dots on this page, 49% are general neglect. And then the remainder are in this order: physical abuse, emotional abuse, and then sexual abuse. And one of the things that's so critical now, and again, one of the imports of the prevention work is so much of this neglect, this 50%, and in some jurisdictions is up to 75%. One of the things that's so important to think about is that general neglect is so closely correlated to poverty. And so we have to think about how do we, go to the root cause of the issues and focus on poverty and helping families who may be in a low income and in a poverty situation rise out of that. What does that look like? And what are the supports, particularly concrete supports and housing and other impacts that we can help make systemic changes to help families come out of poverty? If you go to the next slide, one of the things that is so profound in our work is also that although we know that child maltreatment is not bound by zip code or economic status or race or ethnicity, yet the children of color are more disproportionately represented at every critical stage in the child welfare system because of systemic racism. What this graph shows is that Black African-American children are 3 times more likely to be substantiated as a victim of maltreatment, more so than white children. And again, this is at every stage, and particularly disproportionality with Native American and Latinx children within California. And it's something that we as a collective, but us as a country and as a state have to really understand the impact of systemic and structural racism and begin to dismantle systems that are impacting children and families of color so significantly that children are being separated from their families. If you go to the next slide, you can see that the impact of abuse again is not just on the child, but it's on the entire community. Children who are victims of abuse are more likely to struggle in school, more likely to be arrested as both a child, as a juvenile, as well as growing up. Research shows there's higher costs of healthcare. And children who have been a victim of maltreatment are more likely, research shows, to be unemployed long-term. And if you go to the next slide, you can see that these have accumulated effects on the community at large, with communities impacted with increased homelessness, drug addiction, incarceration, decreases of workforce vitality, and really decreases of community and government resources in terms of being able to support communities. If you go to the next slide, what you'll see is all of that accumulates, and there is a cost. There is a real cost to child abuse in terms of what everyone feels. So it's not just an individual family matter. It's really a community, societal matter. We all pay the price of child abuse. Recent research shows that California, and we're just about to come out with new numbers for 2021, but California has seen a $26.3 billion cost in the impact of maltreatment for victims only in 1 year of 2019. But that same cost continues over a lifetime for victims in 2020, 2021. And so these costs just continue to mount. I think these costs those numbers are so big for me to get my head around. So if you go to the next slide, what we can see is that same amount of money, that $23.6 billion, could send all of California's 3- and 4-year-olds to preschool. And we would still have enough funding to send many of our children to colleges. And so one of the things that's so important, and the Office of Child Abuse Prevention says this quite well, is child abuse costs, but prevention pays. And research is very instrumental in showing that there is a significant return on investment for every dollar invested in prevention. For family resource centers in particular, we are seeing up to a $4, almost $4, about $3.70 return on that investment and focusing on prevention. So that's why the work of the Children's Bureau and the CAP Center and Safe and Sound and other family resource centers throughout the whole state is so important to really focusing on that upstream work. If you go to the last slide, for me, I'll turn it over to Sheila. One of the things that we have done at Safe and Sound is to be able to estimate what the costs are in every county, so that every county has the tools for prevention with their own policymakers, so we can begin to advocate together about implementing prevention activities. And so this is a website that allows you to get more information about the economics of child abuse. And with that, I will turn it over to Sheila, who will lead us through what really the state of the state looks like right now in terms of prevention. And then also, I neglected to say, if anyone has any questions about any of this, please put them in the chat. We're happy to answer questions towards the end of the presentation. Thank you so much. And Sheila, I'll turn it over to you. Sheila, if you are talking, we cannot hear you.
My apologies. It apparently is just something I'm going to do every time I'm anywhere on Zoom. So my apologies. But I think this slide is a good transition for us because prevention really is the antidote. And so we know that, and we know that we can make a difference. And certainly you all make a difference every single day in the work that you do, as do so many people across our state who are engaged in this work. Kelly, next slide, please. I wanted to take a few minutes to talk about what prevention really is. I can tell you that I've been doing this work well over 33 decades. And we've really kind of changed some of how we look at prevention and what it means. Early on, when I was doing this work, the bucket of what prevention was, there's really sort of everything from prevention and intervention and treatment and so on and so on and so on. And we really weren't very clear in the way we talked about it. But we have had some really good help from the Office of Child Abuse Prevention, and I may refer to it again as OCAP, but it is a bureau in the California Department of Social Services that is focused only on prevention. And this diagram that you see is really important because it shows the levels of prevention and how they are really different. And when we talk about it, we need to be clear and specific. So at the most basic level, we're talking about primary prevention. And in that case, we're not talking about a family who's been identified and has risk factors and so on. We're really talking about the whole community and all families, and how we can provide them with the supports that they need so that they don't come to our attention anywhere in any of the systems, whether it be mental health or child welfare, pardon me, or otherwise, that we're being proactive in providing supports. And back to what Katie said, poverty is a huge part of that. So trying to make economic supports for families, giving them access to services, giving them access to healthcare, those kinds of things are primary prevention. And then secondary prevention is when, yes, there has been some identification of a family, very likely because they have asked for supports and need those, and they're not in the child welfare system, but they do need some particular support specific to the needs of that family. And so that might be something like home visitation would be a good example of secondary prevention. Then when we get to tertiary, now we're talking about families who not only have been identified, but have now experienced maltreatment and it's been substantiated. And in that case, there's already been trauma to the family. They've been through an investigation. Perhaps the children have already been removed from the home. The children have experienced real trauma. And so when we talk about tertiary prevention, it's really barely prevention, because now we're talking about trying to reunify a family, providing the kind of mental health supports that children need and deserve when they've been through this process. And so those are really three very different kinds of ways of looking at prevention. And it is important because often people sort of think only way farther down on the continuum, but increasingly what most of us in this field want is no, let's keep going back. Let's go back to primary. Let's never have to know about some of those other kinds of issues and for children to be removed and so on, whatever it is at all possible. Next slide. So I'm going to ask you to kind of bear with me because, like I said, I've been doing this for well over 30 years. And so we're going to take a little trip down my memory lane. Just from looking at your faces, most of you weren't around when some of these things were happening initially. So I want to give some context for how, just a second, my computer went out for a second. I want to give some context for kind of the evolution of prevention, and particularly in our state in California. So next slide. So I've kind of categorized where we've been over the decades, and I didn't go as far back as sticks and rocks and that sort of thing. We're a little bit farther along than that, at least since I've been doing this. But I'm going to go back to the Bronze Age. And in the Bronze Age, basically about the only things that existed in California law were the CAPCs, the Child Abuse Prevention Centers, that they existed, and that every county could designate at least one, and of course in Los Angeles more than that, child abuse prevention centers. And there was the tiniest bit of opportunity for funding, and that basically came in terms of the birth certificate fees. So when a child is born and someone needs a birth certificate, or they're going to play soccer and they need a birth certificate, there's a fee that people have to pay for that. And so a tiny percentage of that is allowable to be used for child abuse prevention. That was really it in terms of what was available to us in the state. At the same time, the CAPCs in particular were very focused on mandated reporter training. And we are all mandated reporters. I'm a mandated reporter. I believe all of you are as well. But at that point, the training in particular was about, we got to go get the bad guys. So we need as many people as possible to report. We want everybody to know how to report so that we can take care of this and save these children and protect them. And that was really kind of the way the thinking was at that point. And also in terms of training at that time, the training was really focused on children, good touch, bad touch, how to be safe from someone, so on, but not very much training for parents, for others, the adults who had responsibility for the children. So that's kind of the way back when I first started in this field. Then we got into the Silver Age. And for a little while, there was a lot of excitement because OCAP, the Office of Child Abuse Prevention, was providing funding for home visitation. They were funding strategies, and strategies being the training and technical assistance network for the nonprofit sector. And you probably know that right now today, Strategies continues, and Children's Bureau and my organization, the Child Abuse Prevention Center, are the two lead organizations that continue that process and that work. At that time also, OCAP was funding for the CAPCs 8 regions with coordinators that brought them together so that regionally they could share work and have special projects, and perhaps like in Child Abuse Prevention Month, they might collectively do things. The regional coordinators and home visitation funding went away. It was kind of a blip in time, but it was very promising. And there are kind of variations now that are continuing to go back and look at that work and do more. Interestingly, at the same time at the state, there was a piece of legislation that passed to authorize a Child Welfare Council for California. And the focus of that was to be improving foster care. However, at that time, the Secretary of Health and Human Services in the state said, yeah, but we've also got to have a prevention committee as a part of this, because the best thing we can do about foster care is not have children enter it, because they don't need to be entering it. So that was kind of astounding at that point in time. And the last thing I'll mention during the Silver Age is that there was a monograph that was really funded through the state and also some foundation money to speak to family resource centers and what their role is and their characteristics. And we're going to talk a little more about that later on. Then finally, the golden age, and I'm considering this the golden age right now that we're in. And that is that now there is home visitation money. There's some federal money through the Department of Health Services, and there's also CalWORKS money that is now being made available for home visitation for any of the counties that want to opt in. 20 years after the first one, there's a new volume of Vehicles for Change, which is about the family resource centers, that really speaks to the evolution of what family resource centers are in our state. Really, surprisingly, there has never been funding from the state of California other than whatever might have happened with birth certificate fees. But now there has been funding in the last 2 fiscal years for family resource centers related specifically to COVID, not ongoing funding, but some funding, which is positive. And I will also tell you, back in the Bronze Age and in the Silver Age, if you were to collectively bring the child welfare directors from each of the counties through their association, which is the the County Welfare Directors Association, and say, so what about prevention? They would have said, and I heard it many, many times myself, that's not our job. That's not what we're here for. That's not what the law says about what we're supposed to do. However, a few years ago, 10 of those child welfare directors from 10 different counties formed their own prevention cabinet under the umbrella of their association. They ultimately then changed the name and now call it the Child and Family Enrichment Cabinet, and they've invited Strategies and some other organizations to be a part of it with them, and are focused primarily and entirely on prevention. And finally, I would say in this golden age, although this is the slowest possible implementation of law I may have ever seen, but there is a federal law that was passed called the Families First Prevention Services Act. And that is designed to provide some funding for a little bit of secondary, but mainly tertiary prevention kinds of activities. And each state can opt in, and in California, each county can opt in. And it is still an ongoing process, and the funding has not happened yet, but it is promising, and it is another opportunity ahead for us. Next slide. So I want to give you 2 examples of what it has really meant in terms of prevention and how it's changed, particularly in the way we've looked at it in our state. And one of those is about mandated reporters. And I think we all know what that means for us in terms of our own organizations. But I think it's really interesting, maybe I'm also a little bit of a history buff, Katie, to look at how we really got into this notion of mandated reporters. There was a published book, The Battered Child Syndrome, that a very noted pediatrician, Dr. Kemp, and a colleague of his published. They were very concerned about child abuse, and they were interested particularly in what medical professionals might be able to do, particularly around physical abuse, because they knew that pediatricians and other medical providers were seeing situations that appeared to be physical abuse of some kind against a child. And they wanted to have a system whereby those medical practitioners could report that, and so that there would be some safety and some protection for those children. So really, mandated reporters started out as medical providers. What has happened since that time is that it has been, up until I think a couple of years ago, just about every year that I've been around in our state legislature, somebody has a bill and they add another category of professionals to the mandated reporter list. It is a very large list now, and it includes anyone who has access to a family or access to their homes. So like animal control people are supposed to be mandated reporters. And they might come in the yard, and the theory was they would see a mistreated animal, and so therefore they should make a report about child abuse if there's a child in the home. So that's much more extreme than the way mandated reporters originally started. The other interesting thing from the very beginning is that there really have not been requirements about the kind of training that people might need in order to make a report. In fact, the way the law reads, it's if you have suspicion, make a report. But people don't really know how to do that. I suspect that if you ask your friendly animal control person what general neglect is, that would be a difficult thing for that person perhaps to speak to. So it is a challenging situation, and it's one that people have begun to be really concerned about, and it is a major policy issue right now. Next slide, please. So this slide, which comes from the California data that's available, I can't explain to you how 82 and 23 should come up to 100%, but nonetheless, what this slide shows is that whether it's educators or legal mandated reporters, medical or friends and families, because not all the reports are from mandated reporters, some of them are from friends or families or other people. When you look at this, what you see is there are a whole lot of reports made. And it's kind of like the dots that Katie showed you. There's a bunch of reports that are made. However, the vast majority of them are not substantiated. There's not a case that's open. So what that means is, simply in several ways, is we have child welfare agencies spending the majority of their time on unsubstantiated cases. So that's very expensive to do that. It takes their time, and it also is traumatic to a family if they are investigated when in fact there has not been an issue, they are simply poor. And then the other part of that is we have not built a system into child welfare whereby if there is some kind of a report, but there has not been abuse, how do you go from that point to making sure that that family, that child, that community gets the supports and needs that they in fact need? Because as Katie said, very often it's general neglect reports, and it really has to do with the fact that the family has needs and supports, and the system is not designed right now. There are some exceptions, but in general, the system is not designed to go from an unsubstantiated report to a situation of providing services and supports to a family. So next slide. Again, as Katie mentioned, one of the other really, really difficult parts about the reports or referrals is the disproportionality. And you can see on this slide, which is very much like what Katie had talked about, that with Black African-American children, they represent 5.1% of the population, but they are referred or reported 12.1%, which is more than double. So then also look at Native American children who are very much disproportionately in the system as well. They are 0.4% of the population of children, and yet they are 0.9% of those who are reported relative to child abuse and neglect. So right now, in terms of the policy frame about looking at mandated reporters, increasingly people are talking about the need to have mandated supporters. So when people recognize or suspect or are concerned, how can they do something to be supportive or to get the family to what they need? And we don't have a system for that right now, but that is a major policy question that's going on. And so you can see the evolution relative to mandated reporters from physical abuse and from medical personnel to a huge list of mandated reporters making lots of reports that are essentially ineffective. Okay, next slide. Okay, the second example that I want to talk about is family resource centers. And I have to tell you, because you all are in the Children's Bureau, that I have many times suggested that people come to your family resource centers because they are so stellar. And so they're great examples of what can really happen in terms of deeply embedded family resource centers working with and guided by their communities. So next slide. We're going to talk a little more about those 2 volumes of Vehicles for Change. And Vehicles for Change is really the way that the authors characterized family resource centers. And the first version of this, which goes back to show how family resource centers were perceived in the year 2000, is that part of the reason for this monograph was that there was a great deal of confusion and misunderstanding about what is a family resource center and what do they do. And so the monograph talked about the services and the supports that they provided, talked about how they are in a part of community, and also talked about the fact that that they did not have funding. That's always been an issue, but that was kind of it. In terms of the monograph. It's very, I mean, I have one and I keep it, and I've had it always, and it is a very important document. But now when we look back, we know where we were in terms of how we looked at family resource centers. So then in the second volume, 20 years later, it was really about the evolution of family resource centers and how it's not that they just provide a lot of services in one place, but that they are really embedded in community, that they are looking to support and wrap around all the families in all the community, and to really bring that community voice strongly into the work, and changing it and really looking at how far we have come in terms of our expectations in that regard. The second monograph had a series of recommendations. And it is very interesting because in the few years since those recommendations, we have seen some pretty amazing changes. And so I want to identify 4 of those recommendations, starting with the next slide. So one of the recommendations was family resource centers need to have a strong one voice, because it continues to be confusing for people of who you are and what you do and what you're about. And so we need to be clear about that and be able to explain to other people, whether they be policymakers, legislators, county or state departments, whatever. We want to be very clear about that. And so my organization was involved in doing some advocacy for family resource centers in 2018. And at that point, finally, the light bulb came on, and some folks from the Department of Finance at the state said, we can't put family resource centers anywhere in legislation because we don't have a definition. We didn't have that one voice. So fortunately, that next year, SB 436 passed, and you can see the language there, so that there is a clear definition. This is what a family resource center is. It is now in code in California, and it opens doors for other opportunities. Next slide. The second recommendation that was in that monograph is you don't have any data. It's great to say that you helped this many people, and that you gave food to this many people, and that you did parenting education for this many people, and so on. But you don't have enough evaluation to talk about the so what. So we did all those things, but what happened? What changed because of what we've done? Well, now there has been a pretty good body of research and evaluation, and these are just some examples. There are more than these, but in a couple of these cases, we show very clear demonstration that providing prevention services through family resource centers reduces the likelihood of a family entering or re-entering the child welfare system. And I can tell you that in Sacramento, where I've been involved with an evaluation and a cluster of family resource centers, there have been 3 quasi-experimental design studies, which is about as, without turning people away and saying we're only going to treat some people and see what the difference is, we have been able to demonstrate very clearly a reduction in child welfare cases. But also, we have research now that talks about the return on investment, which Katie also spoke to. And that's really important. That really is a way of saying we need policy leaders to make decisions to invest in programs and services that actually reduce costs for government agencies. And that's what we have now been able to demonstrate. And each study has a slightly different number to it, but the bottom line is it makes sense. It's good financial sense to do this, in addition to obviously the fact that there's impact and changes that are critically important to the individuals as well as the communities who are served. Next slide. So the third recommendation was that there needed to be stable funding for family resource centers. And as I told you, there have been some blips of things, so back and forth, a little bit of birth certificate money and that sort of thing, really tiny, but not really allocated specifically for a purpose. So obviously we know that our world changed a couple of years ago with COVID. And to our delight, the governor at that time was willing to put $3 million out of the general fund for family resource centers to support families in the early stages of COVID. And so that was really from about the middle of April to the end of June, which was then the end of the fiscal year for the state. So $3 million went out to around 400 family resource centers. The state said, California Department of Social Services, we'd really like for you to, see if you can serve about 35,000 people. Well, in 10 weeks, the family resource centers served almost 120,000 people. So it was very, very supportive of the kind of work and how close they are in with their communities, which they'd also demonstrated in other ways like the census and Affordable Care Act and so on. But this was quite concrete with state money. Subsequently, in this current fiscal year, which will end in July 1, the governor agreed to and put in his budget $13 million. But again, specifically for COVID relief. And that funding is now in play and services are happening. And it appears that there's going to be about 270,000 people served. Lots of services for the same people. So that doesn't mean there's that many services. It means there's that many people. And however, that is not stable funding. It goes away with the fiscal year July 1. Next slide. However, there is a budget proposal that is in the legislative process now for $40 million for family resource centers as ongoing money. And I want you to know that the two people who are the big advocates for that and are working on that and are the co-chairs of the policy committee are none other than Katie, who you've met now, Katie Albright, as well as your CEO, Ron Brown. And I know Adam is on this too, and he's been working a lot on this project as well. So we'll see what happens, but this is the first time that the field has really coalesced around, yes, indeed, we do need ongoing stable funding. So then we go to the next slide, and that was the fourth recommendation. And that was that there be an association that was strong and supporting the field. And that has been happening now through the California Family Resource Association and through the leadership of Ron and Katie to make that happen. But there is now a more robust association. And you probably know, like, there's associations for the district attorney, there's association for child welfare directors, there's association for school principals, there's an association for everything. And those associations are about training and supporting and advocating. And there is now that for family resource centers. So these two examples are very different from each other, but what they do show is an evolution of increased awareness about prevention and about what needs to be done, about what some, we know what some of our problems are, such as the mandated reporting issue. We know what our issues are, certainly about disproportionality throughout the system, essentially every system in the public sector. So we know there's more to be doing. So I am now trying to focus more on what are we going to do in the next age? We went through bronze, silver, and gold. The next one is platinum. And I would love to see comments from you all, either raising your hands or putting thoughts in the chat about what you see as being the next important policy and program changes that we need to do to make our prevention systems even more dramatic and more meaningful and more guided by those who have lived experience and know what we can do best. So I think we just open it up to any questions now that you have or comments about that particular thought.
Anyone that has a comment, go ahead and unmute yourself, or if you'd like to add it to the chat and we could read it from the chat as well. I can speak for one of the things that we've discovered as we're doing our work in Best Start is really what the community is really feeling that there's a need for and that we need to provide more of is really opportunities for financial literacy for all communities of color in every language that we can provide this. We are seeing that it's the key to obviously make some changes in the future. And both of your presentations talked a little bit about that. So I think that's got to be something that we've got to raise a huge flag on.
I will just share that I think that the economic issues are very compelling, and there's some really good research, and it's been done in a variety of ways, and all of them come out essentially the same, but that if you increase the minimum wage by $1, that you would reduce child abuse neglect reports by 10%. So there's, yes, certainly the financial literacy, as well as being advocates for giving families the opportunity to be stable.
I have a question.
Dovetailing off of that, just I think we saw that so much during COVID, where people's financial capacities were restrained. So the converse of what Sheila just shared is equally true, that when we decrease financial capacity, we're increasing the impact on child welfare and the number of cases going into child welfare. Christine, I think I might have interrupted you.
No, sorry. I have a question. So around Best Start, we have a group called the Policy Committee, right? And so their goal is to identify policy, whether it's like a bill or some sort of advocacy that they can support. And so do you see like an opportunity for that, for our Best Start group to support the family resource centers in any way, like via advocacy?
Well, the process is going through the legislature, and it's not a bill per se. It goes through committees that talk about the budget. And you have an amazing advocate in your CEO who is a part of that. And I know, Adam, you're on the call, and maybe you might want to address how that works internally with Children's Bureau.
Yeah, thanks. So there are definitely places that we are looking to get our staff and our partners involved, whether it be advocacy weeks, whether it be kind of setting up meetings with legislators, especially when it's with the legislator that your particular office represents. Assemblyman Verlacki actually is pretty forward on a lot of these things. He's with us on a lot of these, but that's an important thing. We're also working on seeing if there's ways that we can kind of get the tools in people's hands to make it very easy to just make that phone call, to send that social media message, to do that. That's something that I'm hoping will be coming in the next couple of weeks, where we're able to like just get everybody involved, make it very easy to be a part of that. So.
Great.
Yeah.
If you have any questions, feel free to raise your hand with the emoji or type in a question or a comment in the chat box, because we really want to hear from you. This is such great information that will greatly impact our community here in the Antelope Valley. But if you have any questions, comments, feel free to raise your hand. Feel free to leave something in the chat. Okay? Awesome. Awesome. Okay, Sheila, I'm going to turn it back over to you.
Well, thank you all so very much. We're certainly honored to be here with you on your first of your sessions that you're doing for Child Abuse Prevention Month. I want to thank you for all of the work that you do and for your dedication to those that you're serving and supporting. And don't leave the field. Take care of yourself to make sure that you can pace yourself, because it is challenging sometimes, and we all know that. But I'm very honored to be here with you today.
Ladies, thank you so much for all this vital information and the passion that you both share through your speaking. We were absorbing it, and like Darrell said, it, you know, this community in the Antelope Valley is very passionate, and obviously, you know, we want to do as much work as we can. And so we really do invite everybody to, you know, look up some of this information. If we need to help find this, or, you know, share it with the community, we definitely will. But again, thank you so much for being here. Your experience, your wisdom is amazing for us. So we really appreciate having you guys here.
Sylvia, we have a couple of comments left.
Sure, go ahead.
In the chat box. Levy stated that I believe that education, creating quality time events, as well as respite classes children, so the parents to have self-care. So thank you, Levy. I was reading that for you. Yeah, thank you. And Myra said, thank you for letting us participate in this series. For sure, we are learning more about this topic. It is an important topic, especially in the Antelope Valley, where we experience a lot of things with children, death, and things of that nature. So everything that you shared is something that we can definitely implement and utilize and put to practice. Ms. McNillian said, thank you very much for allowing us to be a part of this training. You're welcome. You're welcome. We're going to continue on. Just remember, this is just the first of many. So if you haven't already registered for the next upcoming part of our series, make sure you do that on our Eventbrite. But thank you again, Sheila. This was such a dynamic teaching and so much pertinent information. So much. Sylvia?
Stephanie, if you wouldn't mind sharing in the chat the link to the Eventbrite, where people can register if they'd like to join us in our ongoing speaker series.
Yeah.
And again, thank you everybody for being here with us. We will also have this recording on our YouTube site, which we'll share with everybody via email. We'll share the link. And again, thank you all for being here, and let's keep this work moving. Thank you.
Thank you so much. It was great to be here, and we look forward to partnering together on our work.
Yes. Thank you.